DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Folks, today's going to be a great show. We're going to talk about colostrum with Dr. Manuel Chamorro. We're at Auburn University, College of Veterinary Medicine. Thanks for joining us today. Stay tuned and enjoy the show.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. I'm Dr. Thomson. I'm here with Dr. Manuel Chamorro. We're at Auburn University where he serves as an associate professor in clinical sciences. He is an outstanding researcher for beef cattle medicine, a clinician. We've gotten to work together at Kansas State. He's somebody that's really doing a good job for all of us out there in the beef industry, and we're glad you're going to be on the show today.
Thank you very much, Dan. I'm very happy to be here, and like I said, enjoying my time talking to you.
Good. Well, today we're going to talk about colostrum.
Yes, sir.
So just kind of give us a general, if you're going to sit down to the coffee shop and tell people what colostrum is and why it's important, what would you say?
That's a great question. So yeah, colostrum, I always call it like kind of first milk,
yep.
From the cow, and it's critical, for newborn calves because it provides the calf with immunity. A newborn calf is usually have a complete and functional immune system. However, that immune system of the newborn calf is what I call inexperienced. It doesn't know how to fight infection. So essentially what colostrum is going to give that calf is that knowledge on how to find that infection, how to fight that specific pathogen that is going to try to kill that calf. So that's why it's really important. And besides the immunity that transfers, it provides great nutrition, for that calf for the initial hours of life.
It's got a pretty good nutritional punch with fats and that. So the immune system part of the milk and the caloric density kind of drops off after we have increased milkings, correct?
Exactly, and that's a very good. Thanks for bringing that up because that's one of my interests right now, because as the colostrum transition into milk, we call that transition milk, right? And that transition milk is not milk or it's not colostrum, right? But it still has some components of that colostrum and actually has immunity. Some has specific antibodies. And by day 5 after calving, that becomes already milk, right? So from the beef calf standpoint, that's really beneficial because that beef calf will get still some immunity through the transition milk, for the first 5 days of life. And that's not the same for the day calf, unfortunately, because the day calf will receive colostrum and will not receive transition milk, which, again, doesn't get the benefit as the beef calf does, but yeah, that's correct. Is really interesting, and we are doing some studies here on bovine rotavirus. Using that transition milk to see if that actually, if we prolong the administration of that transition milk, that would result in a lower incidence of calf diarrhea, for example.
So when we're talking about that, we're talking about colostrum is the first milk, and in that first 12 to 24 hours, we're having passive diffusion of those antibodies across the gut wall into the bloodstream. But what we're talking about with this transition milk over a 5-day period, you're talking about constantly bathing that gut and the inside of the lumen with the antibody from the cow, correct?
Exactly, that's correct. Because the colostrum is very rich in antibodies, and since the gut is open the first 24 hours, those go through and then go into circulation, and then they go back to the respiratory tract and back to the GI tract. However, after 24 hours, yes, like you're saying, that colostrum, that transition milk kind of bathes that lining of the GI tract with antibodies, with immunity that likely will reduce disease, yes.
This is very interesting stuff. So let's take a break. When we come back, more here at Auburn University, Dr. Manuel Chamorro.
Hi, my name is Dr. Kirk Ramsey. I'm a professional services veterinarian with Neogen. Today on this episode of Cattle Intel, we're going to talk about colostrum. So we all know that colostrum is a critical component of calf health, as it is the main source of passive transfer of immunity from the dam to her calf. It is also concentrated in a way that loads of nutrients, vitamins, and probiotics can be delivered quickly and efficiently through even small quantities. Knowing these things, here are a few tips to help you make sure your calves are getting everything they can from colostrum. So number one, always have good quality colostrum on hand. If there is even a hint of difficulty for a calf to get up, or if the dam is not producing the way we expect, give the calf colostrum. Number two, if assistance had to be given during a calving, just take the time to milk the dam and feed it to the calf. This will at least ensure that the calf received colostrum once in the first few hours of life. Often, difficult deliveries result in calves not getting colostrum early enough. Plus, the concentrated nutrients of the colostrum can get the calf the quick energy needed to get up and get going. So lastly, colostrum is by far the best source of concentrated nutrients available for the calf. Even if the window of passive transfer has closed, colostrum can be used to supplement calves that are not thriving. Always have some sort of colostrum on hand. Colostrum is one of our most effective tools for total calf health. Look for opportunities in your operation to use colostrum, and then invest in whatever is required so you have it and are prepared to use it when needed.
Thanks for watching Cattle Intel by Neogen.
I've been a veterinarian since 1987. My wife and I set up a practice in Monette, Missouri in 1989. We started using therapies shortly after it came out. I was overwhelmed with the positive response that we were getting from producers. They could noticeably see a difference. I have to admit that I was pretty skeptical at first. I am currently 110% sold on the product. There is no doubt in my mind that this is an added product that we can use on these cattle that is going to make a significant difference.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson, Dr. Manuel Chamorro. We're at Auburn University. It's been a great trip down here. I know that we've had a little cold snap here, but for us in Kansas, man, it's a relief.
Yeah, I have forgotten about that. I lived in Kansas for 4 years, and now I'm back being a Southerner here.
It's great. But Dr. Chamorro is an associate professor in clinical sciences, food animal medicine here at Auburn University. And you know, you're doing some very unique research on colostrum and specifically vaccinating the cow prior to the calf being born. And let's just kind of jump into it.
Yes, specific immunity transfer from colostrum into the calf is that the greater the initial concentration of that specific immunity transfer from colostrum, the longer the persistency of that colostrum immunity in the calf.
Okay.
So the longer the calf may be protected by that.
So the higher
colostrum,
it starts, the longer
just,
yeah.
Yeah.
Yep.
So one of the ideas was, well, what about if we vaccinate the cow before calving to try to increase that titer, that concentration of specific immunity to protect the calf against enteric and respiratory pathogens. And of course, the research is there. This is not new. It has been done for a while. But what we are finding when we vaccinate the cow at preg check, the beef cow at preg check, or the dairy cow at dry off, with a single dose of a killed virus vaccine that contains, respiratory and enteric pathogens, the calf that nurses that colostrum of that cow will have not only greater systemic antibody titers against those pathogens that will last longer, but also the upper respiratory tract antibody titers and the GI tract antibody titers that calf will have are going to last longer. And if that calf keeps nursing transition milk from that cow,
Right.
that is going to expand that protection that, like we were talking about, the bathing of that GI tract and the persistence of those antibodies in the GI tract and that could potentially prevent against infection.
So are
and
you
disease.
seeing this with, I mean, which pathogens are you researching?
So for the upper respiratory tract, we are doing it with BRSV.
Yeah.
For the enteric pathogens, we're doing it with bovine rotavirus, which likely is the most common cause of calf scours, in beef and dairy cows.
I think it's important too that y'all listen, because on what he said is that you're using a killed
Yes,
in these pregnant cows.
In the pregnant cows,
work with your local veterinarian on your vaccine protocols, but you're not coming in here with guns ablazing, modified live in these pregnant cows, because we can cause some major issues reproductively and abortion.
Exactly.
So he's talking about using killed vaccines at the time of preg check for beef cows. Obviously, dairy cows, they're handled all the time, so you can do it at different times. But really, really interesting, because I don't know that anybody's ever looked at the specific sites of infection relative. We just take a blood sample.
Exactly. So that's what like we have done in the past, so where we know the antibodies are there in the blood, but and then when you look at the results of the studies, specifically with calf scours, you see that there is the field trials don't show any clinical effect. However, we believe that if we could show that actually vaccinating that cow would prolong the persistency, or the timing of vaccination to prolong the persistency of that immunity in the GI tract, for example, for longer, up to the time where a rotavirus infection usually occurs, we may obtain some benefit there, protecting that calf.
It's perfect. We're going to take a break. More with Dr. Manuel Chamorro here at Auburn University right after these messages.
The seeds of financial security today with United Patriot Coins Precious Metals Starter Pack, the Patriot Pack. Exclusive offer for our DocTalk family. Call now and secure your financial future. Strengthen your roots with silver and gold. Call United Patriot Coin today and ask for the DocTalk special offer.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson with Dr. Manuel Chamorro. We're here at Auburn University where Dr. Chamorro serves in the field. Are you in field services or internal medicine?
In the hospital, internal medicine and surgery, yes.
Yep. But he's an associate professor and has done a lot of research, is doing hands-on teaching, lots of different things that I've watched him do throughout his career. Just an unbelievable talent. Thanks for being here.
Hey, thank you for having me, Dan.
You bet. So let's talk about what happens when we don't get colostrum.
Yeah, that's very important. So when calves don't get colostrum, they develop what we call failure passive transfer. So which is an inadequate level of immunity transfer that colostrum. And what is important is that calf that has failure passive transfer is that calf is at risk of developing disease and dying due to infectious disease, before weaning, and that can cause major economic losses to beef producers.
Yeah, I guess some of the reasons they don't get colostrum is the cow doesn't claim them, or but sometimes there's human interference. We go out there, I keep telling people there's no need in going out and tagging that calf. In the first 6 hours, that cow knows which one's hers. She doesn't need a tag in its ear.
Exactly. So there are several reasons why a beef calf may not get enough colostrum. We know as the most important risk factor is dystocia. Right. A heifer, a first calf heifer with dystocia. Usually that calf is a little bit compromised. It's not that. Cannot oxygenate very well because has been trapped in the birth canal for a while, and regardless if there is assistance or the heifer or the cow ends up expelling it themselves, that calf usually takes longer to stand up and takes longer to nurse. Usually those calves don't have a strong suckle reflex. Some of the times their tongue is swollen, so they cannot latch very well, and all of those factors lead to inadequate colostrum intake. Yeah. Other factors like disease of the dam, a C-section, where the cow, was after surgery goes and lays down, and several other factors that could contribute to the presentation of this condition in beef calves. But it's not good.
While we need to be paying attention to what's going on, maybe not interfere in the process. But if we just got done talking about hyperimmunizing the cow with a killed vaccine or that because we want to increase the
specific immunity.
Specific immunity, but there is a whole host of immunity that's going on that calf will not receive from that dam of everything that they are exposed to in that environment, correct?
Exactly. So that colostrum is going to provide a really broad spectrum of immunity for what the ecosystem of the farm will offer with respect to infectious agents. So that calf really would be at risk of developing infectious disease and not performing well. Like a study from almost 20 years ago, which is really remarkable, out of Iowa State University, Dr. Duell. Calves with beef calves with failure passive transfer, are a high risk of becoming sick and being treated, a high risk of dying before weaning, and will have lower weaning weights compared with calves that did not get failure passive transfer. So really, like I said, intervention may not be the best. Even recent studies from out of Calgary, and we're finishing one study at North Carolina, show that sometimes human intervention becomes a risk, regardless of what you do. Either you're going to go and push the calf towards the dams to push him to nurse, or you want to tube him with colostrum, that usually results in failure in transfer passive immunity. So it's ironic, but
Let's take a break. When we come back, we're going to talk about your research with North Carolina. You're watching DocTalk. Thanks for joining us.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
One animal has this huge impact on your operation.
BVDV is one of the most costly bovine diseases, with losses of $15 to $88 per head.
The virus will actually cross the placenta and get into the fetus. As it's developing, its immune system will recognize that virus as it's supposed to be here. And so then that's where our persistently infected animals come from. They're going to shed that virus their entire life, and then it's going to impact your operation.
It is important to work with your local veterinarian and partner with IDEXX for the best solution for your operation.
Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson and Dr. Manuel Chamorro here at Auburn University, where he serves as an associate professor. He is a researcher. He's in large animal clinics and surgery. Just a wealth of information, and we've been blessed to have you on the show. Thank you.
Thank you. I'm blessed to be here. I really enjoy and I'm happy for the opportunity. Thank you.
It's great. When we left, you were talking about some research that is ironic that some of the colostrum replacers maybe were providing some interference, the human interference with the mom and the calf and different things. So kind of talk to me about what this research has found.
So you know, it's a previous research at Calgary. Dr. Lisa Games-Jagger has been the leading author in this research, which is really interesting. You know, they found that that human intervention, regardless what human intervention is, let's say you suspect that this cow got dystocia, you know, you want to intervene and prevent failure of passive transfer, and any intervention like pushing the calf to the cow, trying to help him to latch on, tubing him with colostrum, like either if it's a dairy colostrum or it's another beef calf's colostrum or it's a dam's colostrum, or giving a replacer, has resulted kind of increase the odds of that calf having failure of passive transfer. It's ironic because colostrum replacers have been a great alternative for the dairy calves on preventing failure of passive transfer, right? The problem is that we do not have specific recommendations for use of colostrum replacer in beef calves. And if we are using them as we use them in dairy calves, they may not work as we are discussing, right? Because the goal in the dairy calf is to deliver a complete replacement of that colostrum. You know, the dairy calf, you know, let's say you don't have colostrum, you know, you'll give a colostrum replacer, you are going to fully replace that dose of colostrum that he doesn't have. Yeah. But the beef calf, you may not want to do that because likely you want that beef calf goes back to the dam and nurses the dam. So if you fill up the omasum with a colostrum replacer that it may be good but not great, not as the colostrum in the dam, well, that may not be ideal. You want to give a dose of replacer to that beef calf that allows the calf to be still a little bit hungry. It will prevent failure of passive transfer, but also will not satiate that calf enough for preventing that calf going back to the dam and nursing.
It's it makes perfect sense, but something we hadn't really thought about. And in those dairy calves, we're catching them as soon as possible, and this beef calf, we're catching them whenever we find them.
Exactly, you know, and that's an issue because, well, you know, it may be that it's too late when you find them, you know, and that 24-hour window has passed. But I think that you know, like having strategies in place for addressing the issue correctly are important. In a study that you know, once when I was in Kansas State, we did a small study with the junior surgery cows. We do practice C-sections with the third years. And so we did a study with replacers and we compared newborn beef calves delivered through elective C-section. And we did 3 groups. One received the replacer only, and were separated from the dam 48 hours. The other ones received the replacer and were placed back to the dam after surgery, and the other group just was placed back with the dam after surgery. All beef calves, and we measure IgG at 24 hours. Immunity transferred through colostrum at 24 hours, and of course, regardless, of surgery, the group that went back to the dams and nursed that did not get replaced had the greater transfer immunity.
It's perfect. It's great information. You can't replace mama's milk and nature and nutrition and transition and all that, but what a wealth of information. Thanks for being on the show. Thanks for watching DocTalk. Remember, always work with your local veterinarian. You can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson with Dr. Manuel Chamorro, Auburn University. We'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.